My name's Joe Thomas. I'm a GP in Malabar, New South Wales, which is a suburb of Sydney. I've been working there now for about 25 years at that practice. My role would be to support them holistically, because outside of the smoking cessation, which is obviously important at any phase of life, they're now going through a cancer journey with all of its emotional baggage and health challenges in its own right. Certainly supporting them and using the new diagnosis as an opportunity, as an intervention for smoking cessation is worthwhile, and usually take that opportunity. The advantage, I suppose, we have as GPs, we kind of know our patients relatively well. So sometimes you go in with the knife and you just go in hard. Other times you go in gently, depending on their circumstances. I kind of think, within any moment in time, the role for us is to ask the question and gauge where they're at. And some people are ready there and then to quit. Other people are thinking about it, and other people just are not there, even though they know the importance of it. Like I mentioned earlier, I think any new diagnosis becomes a great opportunity to push the issue harder, because often patients are perhaps they might be a little bit more motivated. Often they will be. Often they've thought about it. Often they've thought about the contribution of their habit to their new diagnosis, whether it's cancer, heart disease, diabetes, whatever it might be, and taking the opportunity to again ask the question and just mentioning to them, look, if as you're going through this cancer journey, if you can quit smoking, it will be of great benefit to you in the short term, but also in the long term. And just having those conversations repeatedly. The commonest scenario that comes to mind with that is usually they're saying, well, I'm already dead, doc, so I may as well quit smoking. I may as well continue smoking. And that includes people with lung cancer and stuff. But again, you kind of, if you're having that conversation, you delve into it a bit more and just ask their thinking and their reasoning behind it. Sometimes it's a deflection. Sometimes it's a genuine feeling. Over the years, there's been either no mention of it at all, including with people with lung cancer, to the teams being very proactive in moving forward to set up some sort of plan. Now, I don't. It may well be that the documentation wasn't there, and they had discussed it. I do the same things. I'll discuss a lot of things, and I sometimes fail to document. In fact, I often fail to document half of what I discuss. So it's quite possible that those discussions were had. And when I tend to ask, you usually know whether or not it's been mentioned or not. So in terms of what information, I suppose, again, I think correspondence and communication should, in my mind, should be really simplified. It should be like, we've discussed smoking cessation and have advised this, or we've discussed smoking cessation and advised them to talk to the GP about it. I think whichever way is fine, as long as if it's been a point of conversation, then really just in simple dot form saying what they expect of the GP. So sometimes they want the GP to be the primary person in it. Sometimes we are support person in it. Usually things like coronary artery disease is something that the cardiologists will state straight up smoking cessation has been discussed and encouraged. So I suppose thinking about the different groups, diabetics that would be the same. There are certain conditions where it's so well established that they tend to be very sort of proactive on mentioning it. or asking the GP specifically to have some degree of involvement or to support it or whatever else. Yeah. I don't know if I've necessarily seen that every single time with cancer management. Again, I think if it's been reviewed with the oncologists, then in their correspondence, just document it and state it. This is what we're doing, or this is what we want the GP to support us with, or want the GP to take over the management of. I mean, GPs are very, that's what we do. We care coordinate as much as anything else and manage a lot of chronic disease. So, I think sometimes there's a lot of other comorbid conditions in a cancer patient that we're also managing. And certainly once you've been a GP for a while, you find most patients have got a couple of chronic conditions you're monitoring and managing as part of what you do as a GP. So I think anything that helps simplify that and gets to point, whether it's please do this or refer to this service, I'm actually quite okay. I quite like it when specialists say specifically what they want, because I think it's very helpful. It's as much educational as anything else, because things change over time. Then it elevates it straight away. Now, ultimately, lifestyle changes are the hardest things in my mind to help anyone change. You can all know that we need to lose weight, we need to exercise, but life seems to get in the way and we tend to deprioritize these things. If there isn't an immediate train wreck about to happen, we tend to put it down the list. So I think keeping it on the agenda and putting a time frame on it is helpful. I think it'll certainly help me as a GP, because it may prompt me out of my lethargy with regards to asking the questions and being a little bit more proactive on it. And look, in terms of other support, so if there are specific, I know at the local teaching hospital that we're at, they've got specific teams. I know with Indigenous patients, they've got specific Indigenous-based teams to help with these sort of lifestyle interventions. So I think saying that has been engaged, if it's been engaged with and stuff, is also very helpful. Cancer management is pretty loaded anyway. There's a lot of emotion rolled into it apart from the actual condition. So I mean, I suppose if it's the team have a significant priority is smoking cessation, then usually giving them something, like a leaflet or something saying, this is what we've suggested, please discuss this with your GP. So actually raise it as an agenda item when you do see the GP. Because if that's not done, then they don't see that as, I don't know if most patients there'll be some that are going to be very aware that this is now a big priority for them, whereas there'll be others who will see it as, oh yeah, I've got cancer. Yeah, but I've smoked my whole life. That's normal life for me. So they can downplay the significance of it. Probably end up being the CNC or one of the team. So I think if it's an important part of the management, then I personally think giving the patient a leaflet saying, this is really important and I want you to discuss this with your GP, I think that's a better way of getting the GPs engaged. Putting a leaflet in a bit of reply correspondence, I think, is good for ticking a box. I don't think it'll be as effective. Because, if you give it to the patient to say, this is important to discuss with your GP, it's raised the priority of it. And then, then there is the opportunity for the GP to raise it as a priority and to keep talking about it. I think most GPs tend to think in terms of a problem list and tasks to action. I think all doctors think that way, all clinicians think that way, including the nurse teams and the allied health teams. They all think in terms of the problem list and how to action. So I think in terms of support being given, if it is deemed as one of the goals, even if then there is a time frame on that goals, I think that will really help. Because if like someone embarks on a cancer journey, okay, they're going to have their their initial treatment protocols, whatever that might be, and then there'll be the ongoing follow up. So I think then with all teams that you're working with, if it becomes listed as one of the important things to achieve and a time frame on it, then it elevates it straight away.